Hello, and welcome to another edition of eClinicalWorks podcasts. I'm your host, Brian Saul. Today, we are not coming from you live from the National Users Conference, but this is part of the National Users Conference. But since we are virtual, this is also virtual. Joining me today is Bill Kurtycz. He is the CEO of Hyndman Area Health Centers, and that's in Pennsylvania. They've been clients since about 2014. And so welcome, Bill. Thank you for joining us today.
Yeah, Brian, thank you for having me here today. I really appreciate it. Give you a little backstory of who I am.
Great.
My name is Bill Kurtycz. I am the CEO for Hyndman Area Health Center, which we have three locations. We have the Hyndman Family Health Center, the Bedford Family Health Center, and also the Richland Family Health Center. I've been in this position with the organization for about a year and a half right now, and currently everything's going really great.
That's good. I'm glad to hear that. Also sounds for a year and a half, you've gotten up to speed pretty fast on eCW. And I think we'll see that as we talk a little bit more, that you've really come to embrace a lot of the products and services that eClinicalWorks has to offer. I think we need to start off with how things changed for your practice back in the spring of 2020.
Yeah, that's a great question. Now, back in the spring of 2020, I was the new CEO of this organization. And one of the things that we had to really deal with is COVID-19. And that was a big challenge for us. And, going through COVID-19, trying to deal with the patient population, the fear, the pandemic itself was a challenge for our organization. And so during that time, we had decline in patient volumes that are actually coming into the clinics to be seen. And I connected with eClinicalWorks, and they actually helped us with the launch of televisits, aka telemedicine, which helped us continue with our patient population, helped us with our chronic care management, which was very beautiful. But until I connected with the ECW team, those were some of the features that I didn't know was available until I actually started talking to my project manager.
Oh, that's great. Yeah, certainly, so many practices saw a decrease in their patient census.
And it was only by the good graces of one of your eClinicalWorks team members, Cyril Thomas, that actually helped us through all this. He's a great guy. So little shout out to that gentleman. He helped us a lot. He gives great training. We did train the super user, so train the trainer model. Cyril gives a lot of great training. Then we actually started training our staff members to help the patient population with eClinicalWorks and using a televisit module. And so there's a couple of different ways that it was very easy for them to use it. One, they could have downloaded the Heal app, which is more of a robust app that they can use during their visit. Or two, if they were not very technical with those type of cell phone technologies, they actually sent out an email to the patient population. All they had to do is click on the hyperlink that directed right to the patient visit. But we had a support team. If individuals called and they wanted to learn how to use the app, we had a team available that actually walked them through it's very simple, but they walked them through it. At the end of the day, we just made sure that we had a good, robust training program and extra support system, and it went well with our patient population. In addition to our providers, it was very simple for them also. We just had to get them the televisit jelly bean. We had to make sure that all the technologies worked. We did a lot of troubleshooting, make sure that the software was working properly. And actually, my team right now, they love it. It's very easy to use. It goes right up into their dashboard. They click on it and it starts the visit right away.
Now, that's fantastic. First of all, that great planning that went into that is prior planning is essential. But now that you guys are seeing patients in the clinic at this point, right?
Yes, that's correct.
Okay. Are you going to continue to use televisits moving forward?
Oh, of course. We really want to keep it with us as long as possible. Some of the challenges, though, right now over in the House and the Senate is when the COVID-19 pandemic happened, it actually allowed us to start being able to bill for these services.
Right.
So one of the things is that I would recommend to any hospital or FQHC or community healthcare, do your advocacy to make sure that we can still bill for televisits, because it's a very great program that helps patient populations that have transportation issues, that have mobility issues, or just by geographic location they have problems with making their appointments on time, that actually allow them to do that.
Now, while you were going through all of this, I don't want to call it turmoil, but I think I will. You also decided at that point you were going to seek out some assistance from eCW optimization services.
Yeah.
What prompted that, and what was that experience like?
Yeah, so ECW optimization was a no-brainer for us. My previous job, I was operation compliance manager at the Cleveland Clinic. So I was really in depth with technology and projects to help better our workflows and continuous improvement within the organization. So I brought that skill set over to Hyndman Area Health Center. And so just, with that being within my wheelhouse, I knew that's the route we had to go down. And by doing so, the optimization, well, it's a great opportunity for us, one, to refresh ourselves on the capabilities of the technology of the software platform that you guys have. In addition, the specialists, the team that you have there, they let us know how to optimize and use the software to its fullest ability to not only, for better population care, also to save us money too.
Yeah, that's always an added bonus, isn't it?
Yeah. Also, with that being said, ECW, they really give us the measuring stick to measure productivity, health data analytics, from the front office, mid office to the back office. The system is really robust. They have a lot of great canned reports in there to help us with our daily, monthly operations. In addition, ECW's team has been very helpful if we have to build ad hoc reports in addition, which has been very useful to our organization at hand.
Now, you mentioned something just there that in our previous conversations, I grew to understand very quickly that you're very passionate about, and that would be healthcare analytics.
Yep.
Can you just break down your overall overarching plan view for how your clinics are going to use healthcare analytics?
Yeah, sure. So health data analytics is very important to us. It's the measuring stick for all operational workflows and outcomes. When we look at the patient population, we have to make sure that there's a surveillance of their health, to make sure that we're monitoring and we're catching everything that needs to be done. For example, chronic care management. With eCW, eClinicalWorks is a very robust program to identify the patient population, to make sure that we're reaching out to them when we need to. Also, when they're coming in for their visits or the annual well checks or any type of visit that may take place in our clinics, that the system also alerts us to the fact that certain things to be done. For example, a diabetic patient hasn't had their foot checked since the last visit, which, that's very simplification of it. But those type of things that you need to know for chronic care management to make sure that the patient population is well and healthy. That also, with big organizations, you don't want nobody falling through the cracks either.
Sure. And, that's quality care measurements are so important that quality care measures, I should say, are so important not only for from a patient safety standpoint and a healthcare standpoint, but they're used by so many different organizations to rate how the practice is doing, whether it's CMS or, the larger payers, et cetera.
Yeah, a lot of insurance companies, they will look at, your performance in those areas to make sure that you're doing X, Y, and Z. And with eClinicalWorks and the data reporting, it's a safety net for us to make sure we're crossing our T's and dotting our I's. Yep. In addition to reporting for our UDS reports to the federal government every year, that actually helps us with quality money too. And so since using eClinicalWorks, we're actually to improve our quality in many areas with an organization, from the financial standpoint all the way to the patient care standpoint. One of our goals is to be a patient-centered care medical home, and also to be a center of excellence. And so with the reported metrics, it helps you drive towards that goal.
Yes, it sure does. It provides you the documentation you need to get those delineations. So that's fantastic. Bill, have you got any final thoughts for us as we wrap this up?
So my final thoughts with you, Brian, is to let the people that are currently using eClinicalWorks, or the people that may be thinking about using eClinicalWorks, it's a very robust program. It's been very beneficial to our organization from a quality standpoint and also from a financial standpoint. One of the things that I want to stress, though, you always have to make sure you reach out and connect with your SAM. that's very important to have those relationships, to talk with them. And when eClinicalWorks, reaches out to you, have those conversations with them. You have to, dive down and, really look at what they're offering and, understand, what the product could do itself. And so with the optimization package that we went and did, it's worth every penny.
Fantastic. That's great. Yep. And again, thank you so much for being with us today. It was a great time talking to you. If you'd like to learn more about any of these topics that we discussed, you can find more information, including videos as well as documentation, on my.eclinicalworks.com. And if you'd like to watch more eCW podcasts, you can find them on iTunes, YouTube, and also on my.eclinicalworks.com. Thank you for joining us today, and we hope that you enjoy the National Users Conference. My name is Brian Saul. Please stay safe. Take care.